So in this scenario, we see someone who has normal blood glucose for a period of time, and then we may eventually see a climb that may be dramatic in some cases. But if we were to superimpose insulin on this line, we would see a totally different story. So there are two distinctive time points here where blood glucose is normal, but insulin is way out of control in managing those blood glucose levels. So we first see that this is insulin resistance or pre-diabetes. And it's important to note that glucose and insulin are not the same. We fail to appreciate this sometimes. And from a historical point of view, Dr. Joseph Kraft, who developed the Kraft test, a pathologist using an oral glucose tolerance test with insulin assessment, and in testing over 15,000 of his patients, he found that over 50% of confirmed diabetes cases had normal glucose levels, but high insulin. So this would have been missed if we only test blood glucose levels. So glucose is obsessively being the marker that we concentrate on with diabetes, but it shouldn't be. We have the ability to measure insulin. And it may take up to at least 10 years before we start seeing the rise in blood glucose levels. So measuring insulin can be a preventative measure rather than a cure.